Hello, welcome to Module 1, Part 3. I know I was trying to beat that time, less than 15 minutes, but what I was trying to tell you, everyone, is that this is a cartridge. Morphine and other medications, Dilaudid, sometimes other medications are in a cartridge. Sometimes the cartridge is filled to 1 ml. Sometimes we have a medication that needs to be added to the medication inside the cartridge, but it's not enough room. So therefore, we would get another syringe. We will pull the medication out of this cartridge into a syringe that's big enough to hold the amount that's in the cartridge and in addition to whatever the other medication is in ml. I just wanted to explain that to you. Okay, this we can talk to you about that later. It's just a device to hold the cartridge, but I wanted you to know that this is the cartridge. A lot of the interventions, the action part of the medication administration, I really didn't go over because we can do that on campus clinical. But this one I thought that we should make sure we understand use of one-handed scoop. Remember, we do not recap with two hands, you do the scoop. And it also, this particular needle has a safety on it. But if somehow we had to recap it, we would do the one-handed scoop. I wanted to reinforce the ampule, making sure you understand we do need a filter needle. Now, we don't give patients injections with a filter needle. We use the filter needle to prevent glass particles from being withdrawn with the medication. Okay, so I want to make sure you guys know you're going to take that needle off, the filter needle, and you're going to put the appropriate size needle, regular needle, on to give the patient the medication. Okay. I wanted to reinforce also mixing of the insulin. Please read this area. Moving forward, this would be the chart that we would go by and not ATI in regards to the needle size and the muscles that it should be giving in. So I'm going to move this chart up and down. It's just not that much. Can't get it to move like I want it to, but this is the chart. This will be the site of choice for MSJC for teaching the students, the preferred site for intramuscular injections. So I wanted to show you this, and I highlighted some areas in yellow. And then also, come on, work for me. I wanted to show you a clear picture from your book that's in here, how to place your hands and to get that dorsal, get a good ventrogluteal site for the intramuscular injection. I'm sorry. Okay, so right there, you just know what that hip bone is. You put the palm of your hand over there. Then you're reaching out with your two fingers. And those two fingers, you're going to stretch apart. And right in that area is that injection site. Okay, you're avoiding that whole sciatic nerve that will be over here. Okay, let me finish going through the slide so you can see. And then, okay, so we're not going to go anymore with that. Here's more information on dorsal gluteal. And so I graduated in 1993. This was the site for me to use. However, you know, it's not preferred anymore, best practice. Even though you might not see it all the time going on in the hospital, you are a new generation. Understand what best practice means, and let's follow what best practice states, okay? And then this particular site is more for patients that are home who are able to reach down and give their own self an injection. We really don't use this site. It causes a lot of pain. So we definitely don't want to inflict unnecessary pain on the patient. So we rarely use this site. I would like to reinforce when you're putting on the transdermal patches, make sure you hold down a little firmly before moving your hand so it can really stick. And then also before you put a patch on, make sure that you're checking the patient body for any other patches. I didn't mention with the insulin earlier, but it is recommended. American Heart Association does recommend that you keep the needle in for 5 seconds before taking it out when you give your sub-Q injection. You can read that in your chapter. I'm just reinforcing what it says, but you do leave it in for 5 seconds before you take the needle out. Okay. Here is the clinical alert regarding transdermal patch. One more important clinical alert regarding transdermal patches. Here are some pictures on how to instill the eye drops. I know we didn't talk much about those in the on-campus clinical lab, but we can ask Dr. Filler if she can supply us with some. But most importantly, please do not let the tip of that the tip of the eye drop container touch the eye. Also, sometimes we get, oh my gosh, when we give an ointment, we press too hard on the ointment and then the ointment is gone. But that's okay, because what is recommended anyway is that the first ointment you kind of want to get rid of. So you squeeze a little of the ointment out, like on a clean 2x2 gauze, and then you give the ointment in the eye, okay? So it's still in the ointment into the lower conjunctival sac. So I'm just going to have this go up so you can see it's still in the eye drops, and then the ointment, and then pressing on the nasal sacral duct afterwards, okay? I'm not going to put the whole chapter in here, but I did want to point that out. Some of you asked questions about the eardrops. So in your chapter, here is the instructions on the eardrop, but I don't have it. Let me see if I can scroll up a little bit. I want to assist the client to a comfortable position for eardrop administration, lying with the ear being treated uppermost. And then here's the cleaning area. Administer the eardrops. Read here and know when you should ask the client to remain in the left lying position. So don't have them move yet. Let them lay there for about 5 minutes. Okay, this prevents the drops from escaping. So if they move, you're gonna see it just roll right back out their ear. And then here's a little picture. So I know someone says that we pull up, pull back, pull down. So straighten the ear canal by pulling the pinna upward and backwards. Upwards and backwards. Up and back, okay? And don't forget to have them lay on their side. You might have to be in a position where you might have to irrigate the ear one day. Now, on campus clinical, we can go over nasal drops and on campus clinical, and then also vaginal medications. We will have to do those from time to time also. And then I didn't see in here, but for rectal suppository as well. I wanted to reinforce inhaled medications. Make sure, number one, very, very important. When you give bronchodilators and steroids, you want to give the dilator first. Okay, so it opens up a way so that medication can get down in there. And in addition to that, you want to encourage your patient to always rinse their mouth after a steroid. Okay. In addition to that, each doctor and the pharmacist may be different, but I wanted you to know both ways. So this is an inhaled bronchodilator, or it could have been a steroid. It comes the same way. This blue chamber, it helps the patients who can't get that rhythm together. The medication goes inside here, and then they put their mouth, once this cap is off, they put their mouth around here and inhale the medication that's being trapped inside the chamber. What I wanted to also mention, as you guys read this, there's 2 different ways. So you can say, oh no, you're not supposed to do it this way. What I normally teach the patients to have it about 1 to 2 inches from the mouth, squirt, and take it, excuse me, take a deep breath in. But as you see in our book, it also teaches the other way also, where the patient can put a sealed mouth around there, take the deep breath, and get the medication, the inhaled medication that way. This is the spacer. We call it spacer, and it's called extended spacer. They squirt the medication in the spacer, put their mouth around that, the mouthpiece, and then the medicine stays in here until she or he takes a deep breath. And this is all found in your chapter, Cozy and Herbs, and there's the rest of the instructions. Okay, here's the highlights for chapter 35 review. So you guys definitely can see this also. Oh, I'm going to pause. I had cut off some of the words, so I just wanted to repeat. So you don't forget medications have several names. Don't forget about the drug legislation regulations, the production, prescription, distribution. Remember how I talked to you about the prescriptions also. The Nurse Practice Act. Remember, if we give medications, we're responsible for it as well as the person who ordered that medication. So let's make sure we give the safe medication, safe route. Know what your drug allergies, drug tolerance, all of these are. Several factors other than the drug itself can affect its actions, and we talked about the older adult also. Know physical, when patients are having withdrawal, they have psychological or physical. So know those, and several factors other than drug itself can affect its actions. Know all of these. These are just a quick review. I tried to go over the entire chapter in here, and this is important. The Z-Track method for intramuscular injection is recommended because it's less painful than a traditional injection technique and decreases leakage or irritating or staining medications to the subcutaneous. So this is a new best practice, okay? And then here right above, it says the dorsogluteal site should not be used for injection because it poses unnecessary and unacceptable risks to the patient. Okay, so let's look at these things and review all of these and see what you have learned and what we can all do together. Okay, don't forget about that topical medication. Don't forget about the it's okay if you do the ointment, you squirt so much out. You want to squirt a little of the ointment out before you give it to the patient, administer it to the patient. So squirt a little bit out on a sterile 2x2 and then administer the ointment. You always want to do that first. Never give them the first ointment that's coming out of that end of the ointment tube. Okay, thank you so much. And next will be, this is the end of module 1 for medication administration, and a blueprint of this will follow. Please go to the skills lab to reinforce your skills. It's open. It should be open this week. Please go to the skills lab to reinforce your skills or anything that you feel uncomfortable with. I would recommend everyone to look at the size of needles, the gauges, the 1 inch, 1.5 inch, 5/8 inch, and also ask a filter needle so you know the difference, why we use a filter needle. Okay, thank you so much and good luck with everything, and I hope this was a halfway decent review for you. Have a good day, night, or evening, whatever time you're viewing this.